I'm Laura Stasla. I'm the Assistant Clinical Operations Manager here at the IU Health Infield Care Center at the Indianapolis Motor Speedway. This is my 16th season working here. I'm going to show you around to the driver care area here. When a driver has an incident on track and they need to come to us to be seen for medical clearance, they'll enter in either through the 1200 car where the physician on track rides along, or if they have an injury to a lower extremity or something more severe, they may come in by ambulance. So they'll enter through this door here. We'll assign them to one of our beds here. We have all of the equipment that we need to stabilize, anything from someone who might need an ice pack to something much more involved. We have machines to monitor vital signs, cardiac monitor, we have airway equipment, we have an ultrasound machine. We also have blood on hand if we need to administer any blood. We also have IU Health Lifeline on standby to fly a driver out, but we also have ambulances who can quickly transport a driver within minutes to Methodist Hospital, and have the capability of having the trauma team on standby there at Methodist ready to receive the driver as soon as they arrive. We have all sorts of orthopedic equipment here. We have any orthopedic supply you can think of that one might need. We have a physical therapist on site. We have on race day, orthopedic surgeon, a trauma surgeon, and a neurosurgeon here, in addition to all of our emergency medicine physicians that we have here. We have 6 emergency trained nurses who travel with the INDYCAR series. And during the month of May, all of us are working here. On race day, all of us will be here. In addition to caring for the drivers when they have an incident on track, we also see them here just for any illnesses they might have. We also care for any crew members who might have an injury as well. We also have an X-ray machine to help determine what level of care drivers might need. We also do driver's physicals during December typically. We have an EKG machine. Everyone gets the same testing before the start of the season. So we'll get an EKG, vital signs, lab work. They will see our optometrist here or audiologist, and have a concussion screening as well. When the drivers come in after an incident, even if they tell us they're completely fine, nothing hurts me, nothing's bothering me at all, they are going to get a comprehensive exam regardless, head-to-toe exam. In addition, we do concussion screening for every single driver. We compare that to the baseline screening that they have at the beginning of the year during their driver physicals. Our neurologist, Dr. Vargas, will explain to you some of the more comprehensive tools and screening and assessment that he does.
I'm Dr. Bert Vargas, and I'm a sports neurologist that has the pleasure of working with this amazing INDYCAR medical team. I was added last year as part of an initiative to continue to enhance the already amazing safety and medical oversight that these drivers have, which is probably the best in professional sports. One of the things that is at the top of our mind is concussion. Someone with concussion doesn't necessarily know that they're experiencing signs and symptoms of concussion. And that's where my job really becomes important, is to draw that information out of the drivers, to know how they are in terms of how they act, how they speak, how they carry themselves, so that me and the medical team can identify when they're not acting normally. We also have a number of objective tests that we can do quickly and accurately in the care center when everyone comes in. One of the first things that we'll do is I will be observing how they walk in, how they carry themselves, how they're acting and behaving, how they're talking and what they're saying. And then once our physicians at the bedside finished doing their general exam, then I'll step in and I'll do a very detailed evaluation of how their brain is functioning and how their spinal cord is functioning. And part of that includes some very detailed evaluations of the eyes. We have some tests that we do on an iPad that we have an established baseline for them, and we'll have them repeat this test where they're looking at a series of numbers. And it's a really difficult exercise to do if you have a concussion. It's difficult to coordinate those eye movements in an accurate way so that they can get through this exercise as fast as they did at baseline. At the end of the day, it is a human that can integrate these tools into the decision-making process, along with context, along with the knowledge of what happened on the track, along with the knowledge of what kind of G-forces that car and that driver experienced, and also what we know of them at baseline. But this is another tool where we can objectively measure pupil size at the start and the end of a light stimulus, but we can also measure the velocities, the speed at which their pupils constrict and the speed at which their pupils dilate. And this is a really fantastic objective insight into how their autonomic nervous system is functioning. The autonomic nervous system can be an early indicator of a sign of concussion. And again, it's just integrated into the overall collection of tools that we have to make good, informed, and fast decisions, because we don't have a lot of time with them in the care center. But at the end of the day, if we need more time, if we need them to come back, we feel very comfortable doing that. And the drivers feel very comfortable with us and trust us to make the right decisions. And they are so good about coming back when necessary, because at the end of the day, their goals and our goals are in perfect alignment. And it's about keeping them in the car and keeping them safe and doing what they love.